the full availability of, say,
grocery stores.
Grocery stores. Many of the areas within the county are relative food deserts. So that it's easier to get a gas station, is easier to get a fast food outlet than to get to a grocery store.
Dr. Brown, we've talked about food deserts before. So what in your mind, what is a food desert, and why is it such a big problem in Prince George's County, which, by the way, is not a poor county? Prince George's County is a very wealthy county now. So it's not about money, is it?
Well, wealth is one is always fooled by statistics. So the Prince George's County is a very large county. There are areas of significant poverty, and there are areas of significant wealth. So when you do the average looks very good. But when you do the median, or you end up with a totally different a set of numbers.
So you say it's misleading. It's a little bit misleading to make that comment.
It is misleading.
Okay.
So there are no, because of the large geography, it is sometimes not easy for grocery stores to place a facility.
I see.
And because the bus service, the transportation system, is geared to automobiles as opposed to public transportation, this adds another level of difficulty in getting from point A to point B. That when you look at equity, unless you look at the entire global environment of policy, physical environment, road structures, planning, you really are only looking at a very limited slice of the impact on healthcare.
Dr. Brown, this is a huge, what I'm hearing you say, if I've interpreted this properly, is this is a huge, huge problem, bigger than obviously both you and I, that we're not going to be able to solve in the next hour. So what can we do? And I'd like to talk to you from the perspective of your practice, which is for many, many years. So I'd like, if you can share with us, what did it look like maybe 20, 25 years ago? Was the problem that big, or would it have been easier to try to fix it back then? And here we are 25 years later. Is it too big to even fix? And where do we start?
It is not too big to be fixed. One, several forces are converging to force a solution.
What is it that we can do to address this problem?
Well, number one, it's the onus rests with us as individuals. The society is a collection of individuals, and what we know is, first and foremost, if the state will take the responsibility of delivering clean water to its citizens, it means that we can then tell each citizen drinking sweet tea, Pepsi Cola, Coca-Cola juice is not right in the volume that is being consumed. Just taking that off the table is a significant advance.
I see.
Many people drink their calories.
And how does that go over? And it feels like you're saying that day in and day out to your patients. I imagine
that's a true statement.
That's a true statement. And so how does it go over with your patients when they hear this from you? Have they ever heard that from their doctor before? A doctor that took the time to even
possibly had, but that is one of the things that I go out of my way to emphasize at each visit with each patient, irrespective of the reason they come in to see me.
And I read those reviews on your website. Some of the patients made those comments that you took the time to actually, get to know them and ask some questions, and you did talk to them in a way that a physician didn't.